So let's dive into our first topic, which is understanding the causes and risk factors of osteoporosis. By learning about these factors, we can identify our personal risks and take preventive measures to protect our bone health. First, it's important to know that osteoporosis is a condition where bones become weak, brittle, and more prone to fractures. This happens because our bone density decreases as we age, and the body is less able to replace lost bone tissue. Now let's look at some of the key risk factors for developing osteoporosis. 1. Age. As we get older, our bone density naturally decreases, making us more susceptible to osteoporosis. This process starts around the age of 30 and accelerates after the age of 50. 2. Gender. Women are at a higher risk for osteoporosis, particularly after menopause, due to the drop in estrogen levels, which plays a crucial role in maintaining bone density. 3. Family history. If someone in your family has had osteoporosis or fractures related to the condition, you may be at a higher risk of developing it as well. 4. Lifestyle choices. Certain habits can increase our risk for osteoporosis, such as smoking, excessive alcohol consumption, and a sedentary lifestyle. Now that we know some of the primary risk factors, it's essential to identify our personal risks and take preventive measures. Some actions we can take include maintaining a healthy diet rich in calcium and vitamin D, engaging in regular weight-bearing and muscle strengthening exercises, quitting smoking, and limiting alcohol intake. Remember, the earlier we start implementing these changes, the better our chances are of preventing osteoporosis and maintaining strong, healthy bones throughout our lives. Moving on to our second topic, let's discuss the symptoms and diagnostic methods for osteoporosis. Early detection and timely intervention are crucial in managing this condition and preventing further bone loss. One of the challenges with osteoporosis is that it often goes unnoticed in its early stages, as there are typically no symptoms until a fracture occurs. Some signs that might indicate osteoporosis include 1. A sudden, sharp pain in the back, often following a minor fall or injury. 2. Loss of height. Over time, charge a stooped posture or curved spine, also known as kyphosis. Now let's talk about the diagnostic methods used to detect osteoporosis. If your doctor suspects you have osteoporosis, or if you're at high risk, then they recommend one or more of the following tests. A deep bone density test, also called a DEXA scan. This is the most common test for diagnosing osteoporosis. It uses low-dose X-rays to measure the amount of mineral in your bones, specifically in the spine, hip, and wrist. The results are compared to the bone density of a healthy young adult to determine your risk of fracture. 2. X-rays. While not as precise as a bone density test, X-rays can still reveal fractures or changes in bone structure that may indicate osteoporosis. But in urine tests, these tests can help rule out other medical conditions that might be causing bone loss, such as hyperparathyroidism or vitamin D deficiency. By being aware of the symptoms and diagnostic methods for osteoporosis, we can ensure early detection and timely intervention, which will significantly improve our chances of managing the condition and maintaining our bone health. Now that we've covered the causes and diagnostic methods for osteoporosis, let's move on to our third topic, the various treatment options available to manage and slow down the progression of the disease. Keep in mind that while there's no cure for osteoporosis, these treatments can help strengthen bones and reduce the risk of fractures. 1. Medications. Several medications are available to treat osteoporosis, and they work in different ways. For example, bisphosphonates slow down the process of bone breakdown, while rank ligand inhibitors help regulate bone remodeling. Your doctor will determine the most appropriate medication for you based on your specific needs and risk factors. 2. Hormone therapy. For postmenopausal women, hormone therapy can help maintain bone density by replacing the estrogen that's lost after menopause. However, this treatment comes with potential risks and side effects, so it's essential to discuss the pros and cons with your doctor before starting hormone therapy. 3. Less nutritional supplements. Ensuring that you're getting the right nutrients is crucial for maintaining bone health. Calcium and vitamin D supplements are often recommended for people with osteoporosis, as these nutrients are essential for bone formation and strength. Be sure to talk to your doctor about the right dosage for your needs. 4. Injectable medications. Some osteoporosis treatments, such as teriparatide and abaloparatide, are administered through injections. These medications stimulate bone-building cells, promoting the formation of new bone and increasing bone density. However, these treatments are usually reserved for patients with severe osteoporosis or those at high risk of fractures. Remember, finding the right treatment plan for you is a collaborative effort between you and your healthcare team. By working together, you can develop a strategy that will help you manage osteoporosis effectively and maintain your bone health as best as possible. Let's now focus on our 4th topic, which is exploring the importance of a balanced diet and regular exercise in maintaining bone health and preventing osteoporosis. A well-rounded diet that includes essential nutrients like calcium and vitamin D is a crucial factor in keeping our bones strong. Calcium is the primary building block of our bones, while vitamin D helps our body absorb calcium more effectively. Foods rich in calcium include dairy products, leafy green vegetables, and fortified cereals. For vitamin D, you can find it in fatty fish, egg yolks, and fortified foods, as well as through sunlight exposure. In addition to a balanced diet, engaging in regular weight-bearing and muscle strengthening exercises is essential for maintaining bone health. These exercises help promote bone formation and increase bone density. Some examples of weight-bearing exercises include walking, jogging, dancing, and playing tennis. For muscle strengthening exercises, you can try activities like lifting weights, using resistance bands, or practicing yoga. By incorporating these dietary and exercise habits into your daily routine, you can significantly improve your bone health and reduce your risk of developing osteoporosis. Remember, prevention is always better than cure, so it's essential to start taking these steps as early as possible to ensure a lifetime of strong, healthy bones. Lastly, let's discuss the potential complications of untreated osteoporosis and the importance of prevention and management strategies. The primary concern with osteoporosis is the increased risk of fractures, as weakened bones are more prone to break even from minor falls or injuries. The most common fracture sites are the hip, spine, and wrist. These fractures can have severe consequences, such as 1. Remove chronic pain. Fractures, especially in the spine, can cause persistent pain that affects your daily life and overall well-being. 2. Reduced mobility. Hip fractures, in particular, can lead to a significant loss of mobility, making it difficult to walk or even move around independently. This loss of mobility can result in a decreased quality of life and an increased risk of further health complications. 3. Height loss and spinal deformities. Multiple spine fractures can lead to a loss of height and spinal deformities, such as a stooped posture or a curved spine, which can cause additional pain and discomfort. 4. Emotional impact. The pain, reduced mobility, and loss of independence associated with osteoporosis can also take a toll on your emotional well-being, leading to feelings of depression, isolation, and helplessness. Given these potential complications, it's clear that focusing on prevention and management strategies is essential in maintaining bone health and minimizing the impact of osteoporosis. By understanding the risk factors, recognizing symptoms, seeking early diagnosis, exploring treatment options, and maintaining a balanced diet and regular exercise routine, you can significantly reduce your risk of developing osteoporosis and its associated complications. Remember, knowledge is power, and being proactive about your bone health can make a world of difference in preventing and managing this silent bone thief.